All right, Dr. Emer, we are live.
Hey guys, we're in New York and I'm really excited because we have one of our babyface clients looking to get that masculinization today.
Thank you.
And he just wants a little bit of facial sculpting. And you remember I told you guys, fillers aren't all about adding volume. It's about sometimes adding structure and shaping. He already has a really great face, but I just want to build out his jawline and chin a little bit. He already has a really contoured cheekbone. He's got nice proportioned temples, folds are natural, and he looks like a baby. He's got perfect skin because he's following all of our protocols.
Thank you.
Exactly, you're welcome. So now we're just gonna do slight tweaking. So what we're gonna do, I'm gonna use Radius. You might wanna come on that side, Jordan, the other one, or switch, it's up to you. And I'm gonna start on the bone. He's a really strong guy. He does really good with the filler. So we're gonna go really slow at first. First, I'm going to build out a little projection, and this little bit, you guys, does so much for people, especially since he has a little bit of a rounder face. Doing good. It helps give that projection and that width that makes you look more slim. You can already see a little bit of improvement there.
Someone wishes they could meet us, guys. We'd love to meet you too. You guys can send us a DM, full name, email, and phone number. We're in New York. We will be in LA again.
I'm trying to build a little width here because the central part's already now a little bit projected, so we're gonna go a little wider. If you actually look at the distance, if you draw a line here and we go down for the mid-pupillary line, we can actually extend his chin about this far. This is the proportions, we call these sort of the proportions of phi. And we can sort of extend that and support the lower cutaneous lip, which I've talked to you guys about a bunch of times, here to give him that boldness there. So you can see that side already looking improved. Now we're gonna switch sides. He's doing great. There's numbing that we do topically, and then there's numbing inside. Go ahead and switch with me. Perfect. So now it's widened a little bit.
Someone's asking about us doing TCA cross. Yes, guys. Dr. Emer just did it for a patient right before this.
Exactly.
We do that. If you guys need that, send us a DM, full name, email, and phone number. We'll get in contact with you. If you do need us to see you on the East Coast right now, let us know. We'll get you in as soon as possible.
And you guys can see already, look at that width now, which I think looks awesome on his face because it really builds it out. You can show it in 3D. I'm gonna give that a second. Now remember, with Radius, this is a calcium-based filler that makes it a little bit bigger at first, and then it kind of goes down. So I always tell people, you know, Radius tends to look a little more robust is my wording at first, but done this for a really long time, so you want to give it the time to heal, a couple weeks, and then it'll settle in. And again, you can see just based on the proportions of phi, we can kind of come outward a little bit. Same if we were to do an implant. Perfect. And give a little support laterally and to the lower cutaneous lip area. Perfect. Okay, so now I'm going to leave that a second. Just take a look and make sure we have that boldness there. Excellent. And now we're going to come back and just kind of identify the 90-degree angle of his jawline. You can see here, turn a little this way.
Mm-hmm.
Perfect. Right there is where we want the 90-degree. We're just going to just do a little right on the edge. So Gene, you'll hold here, okay? I'm going to come around the side. We're not going to overdo it.
Let's look at both sides there, you guys. You see the side we just did right now. And here's the other side.
Just small bit. Can you get Q-tips? Then I'm going to have you Q-tip. Bite down for me a second.
Mm-hmm.
Good, so we can actually see the angle.
So wants to know how much product in total are we using?
We're going to use 4 syringes in total. Okay, Gene, come over here and kind of Q-tip
So
that
let's
so
see,
you can
how much is this treatment? Guys, we can give you a consult with us. Send us a DM, full name, email, phone number. We'll reach out to you. We'll get you as soon as we can.
Okay, I'll turn this way. Great.
Someone
Bite down
said,
again.
someone said late to the party. Is this Radius?
Yes, it is. This is Radius. We're building upon jawline's enhancement and doing a very specific way that allows us to get a lot of superficial collagen production. Exactly.
Someone said this dude is so happy to get this done. He hasn't stopped smiling the whole time.
Exactly.
I am happy.
That's what we want, you guys. Okay, bite down again. Okay, relax. This side needs like a little bit more, but again,
Does Radius last longer than Voluma?
it does. It does. Okay, hold on. The issue is when you've already built some collagen, the radius tends to be a little harder. So we need to do a little bit of what we call Q-tipping. So Gene's gonna come over here, do a little bit more, and then it'll even out. That's great.
Are we diluting or are we just transferring it to a different syringe?
Not transfer. No dilution. Bite down again. Perfect.
So let's talk about dissolving Radius, Dr. Emer.
Can't dissolve it. So if you don't like it, you gotta let it sit. There's things you can do to soften it. Perfect. So this side's done. Bite down again. So take a look. We have now that 90 degree. We don't want to go too much more because it'll make him look bulky. Chin looks amazing. You guys can see that. Gene, come switch sides now. We're gonna finish up. Are you doing it? Good. So if you're looking out from the front, look when he bites down.
Someone says, I have nodules of Radius. How can you treat those?
You gotta come see me. We can. There's actually easy ways to improve that. Just gotta make sure. Go to an expert next time. It's key.
So it says, all right. If Dr. Emer has a patient who needs post-inflammatory erythema fixed ASAP, what combo of lasers would he do?
Come see us. That's
Guys,
difficult.
you gotta
But we
come
can
see
do
us.
it. We can do it.
You gotta come see us. We can do it. But you need to send us a DM with your full name, email, and phone number. We'll reach out to you. We'll get you a consult. And we'll get you taken care of.
You okay? All right. We're basically
Do you
done.
train on this procedure?
Yes, we do.
Yes, we do, guys. Email pj@jasonemermd.com.
We should be done. Just make sure it's not bleeding too much over there. You hold it here, Gene. Bruce. Just firm there.
What happens if I don't like the results of Radius?
Can't reverse it.
Yes, you can't reverse it. You can do certain things to soften it a little bit, but make sure you're going to someone you trust and someone's technique that you like if you're going to do it.
Yeah, hold firm on that one spot, please. All right, I'm gonna clean them up now. I'll show you guys in a second. Right now, it's yeah, right. I want you to hold it right there. Just making sure because I did a lot of pokes on the chin, so it's likely gonna be a little swollen. It'll go down. And then same thing on the area where the radius is, because I injected a little bit differently this time. Yeah, hold it right there again. Hold it stuck. get the mirror, or why don't you do an Emer reveal first?
All right, guys. So, guys, the Emer reveal is we're gonna pass this phone to our patient. He's gonna get to see himself in the selfie mode for the first time.
It's gonna look a little bumpy.
It's fine with me.
The first time. It's gonna look a little bruisey and bumpy. It'll go down.
And
They'll do
we'll-
icing. Go ahead and give him the mirror, or give him that one first.
all right, we're gonna give our patient the phone. Here you go. Let's see how he looks. Hold the phone.
Hold there.
Oh, nice.
Hold it.
Hold it here because it's actually really good lighting.
Oh,
So
wow.
this is a little bit of a bruise and it's a little bumpy, but it'll go
That's
down.
fine.
So more projected and more
Mhm.
wide. Turn this way a little bit and turn the other way a little bit so you
Mhm.
can see each angle. Turn a little this so you can see. There we go. And then turn the other way. Hold on. This way. No, turn.
He's so happy. He's so happy there.
There you go. Okay, good. Let's switch it. It'll be easier to see in that light.
I love
So
it.
you guys can
Thank
see
you.
it. It's going to be really good when this swelling goes down a little bit, there's a little bruising here, and when that bump goes down, it's going to settle. It'll take like a week, you guys.
Totally normal, anyways.
I agree. Okay, ice pack, and then here, take a look now.
Oh, thank you. I appreciate it.
This is going to look really big, you guys, right now because we widened this slightly up through here. Once this settles, it's going to go down about 20-30% in about 2 weeks. But the projection is the key. That's what I want you to look at. Nose to lip to chin, and then a little bit more width. And then here, this lumpy bumpy will go down. The key is to look at the 90-degree angle. That's what we want, is this angle right here. So Jean's going to ice right now. Gonna wrap it with this piece, two of these. And then we're going to clean you off and you'll be good to go.
Thank you
Red
so
light,
much.
it'll settle down, and then we'll see him in 2 weeks.
Thank
It's going to
you.
be great.
Appreciate it.
Bye, guys. Your jaw, I think you may not even need filler again for